Hello, I'm Dr. Shyam. I'm the cardiothoracic surgeon for JSSH Hospital. The theme of World Health Day, of which will be celebrated on the 7th of April this year, is Depression. Let's talk. Friends, anybody can suffer from depression. Nobody is restricted to it. Depression has been characterized by a lot of internal suffering. There's this persistent sadness, there's loss of energy, loss of inability to do your day-to-day work, a sense of worthlessness, hopelessness, and so on. Along with it is associated anxiety and restlessness, which leads to self-harm and suicide tendencies. You should also know, as a cardiothoracic surgeon, diseases like diabetes, hypertension is also associated with depression, and the reverse can also be. People with depression can have diabetes and hypertension too. What is alarming is the number of people with depression, particularly among the young, is rising day by day. That is why the WHO has chosen the topic depression, and let's talk about it as the theme this year. Friends, fortunately, you are not alone. Help is available, provided you talk about it. It is important for you to open up and talk about this problem. Do not deny that you have a mental health problem. Do not bury the problem. You need to be open up so that we can, with the help of your friends and family, society, and medical workers, can definitely help you to prevent and treat this problem. There is always a stigma attached to depression. That is why, particularly in Indian context, people do not want to talk about it. But once the awareness is built up, your friends and society are able to accept that mental health problem is not a major problem, because all you need is help to identify the problem early and treat it early. People are ready to accept this stigma, this problem, and this will not be a stigma anymore. The biggest problem we face is, because of the stigma, people do not go for help or seek help. My request to the people of our fraternity, the medical fraternity, the public as large, is to accept that mental health problem is not confined to one particular group of people. This is a global problem. The number of people with mental health problem is rising by the year. It's important that we raise an awareness. Together we need to raise an awareness. We need to have better resources to help these people, better policies to bring forward and help these people, mainly by talking to each other. The barrier has to be broken. People should open up. We need to help them to open up, to talk about the problem and discuss the problem. My only plea to you is, if you feel sad, you feel depressed, you feel at loss, you feel you are worthless, please talk about your problem to your near and dear ones and to your doctor. Thank you once again.